What if I told you that by age 75, you could lose 30% of your muscle mass, but there's a 72-year-old grandmother who became stronger than she'd been in decades? Hello, I'm Dr. Elise, and welcome back to Senior Vitality Pro, where we unlock the secrets to thriving after 65. Today, I'm going to reveal why most seniors are unknowingly sabotaging their strength and independence, and share the exact protocol that helped Margaret transform from being afraid to leave her house to dancing with her husband again. We'll cover the hidden protein mistake 9 out of 10 seniors make, the 2-minute daily test that predicts your fall risk, and the surprising truth about what your body can actually achieve at any age. If you're ready to discover how to turn back the clock on muscle loss and reclaim your vitality, give this video a thumbs up right now, and let's dive in. As we age, our bodies go through remarkable changes. Some are visible, like gray hair or wrinkles, but many of the most important changes happen inside our bodies where we can't see them. Today, I want to focus on one particular aspect of aging that deserves our attention: the gradual decline in muscle mass and bone density that begins around age 30 and accelerates after 65. This isn't just about looking strong or feeling young. It's about maintaining your independence, preventing dangerous falls, and preserving your quality of life for years to come. Let me share something that might surprise you. After age 65, we lose approximately 3% of our muscle mass every year if we don't take proactive steps to prevent it. That means by age 75, someone could lose 30% of their muscle mass. This condition, called sarcopenia, affects nearly 30% of adults over 65 and up to 50% of those over 80. But here's the encouraging news: this decline isn't inevitable. With the right knowledge and consistent action, you can not only slow this process, but actually reverse it in many cases. What's even more alarming is that this muscle loss doesn't happen gradually and evenly. It accelerates dramatically after age 70, and the muscles we lose first are often the ones we need most for daily activities. The quadriceps muscles in your thighs, which help you stand up from chairs and climb stairs, can lose up to 40% of their strength between ages 65 and 85. Your grip strength, which correlates strongly with overall health and longevity, typically declines by 20 to 25% during this same period. These aren't just numbers. They represent your ability to open jars, carry groceries, and maintain your independence. Now, I know what many of you might be thinking. Dr. Elise, I'm past my prime. Isn't it too late to start? Absolutely not. Research consistently shows that people in their 70s, 80s, and even 90s can build significant muscle mass and improve their bone density with proper intervention. One study published in the Journal of the American Medical Association followed adults over 70 who began a resistance training program. Within just 12 weeks, participants saw a 25% increase in muscle strength and improved balance that dramatically reduced their fall risk. The human body is incredibly adaptable at any age. Your muscles respond to stimulus whether you're 25 or 85. The key is understanding how to provide that stimulus safely and effectively. This is where many people make critical mistakes. They either do too little, thinking gentle movements are sufficient, or they jump into activities that are too intense for their current fitness level, risking injury. The sweet spot lies in progressive resistance training combined with adequate protein intake and proper recovery. Let's talk about protein first, because this is where I see the most confusion among my patients over 65. The current recommended daily allowance for protein was established decades ago and doesn't account for the increased needs of older adults. Research now suggests that adults over 65 should consume between 1.2 to 1.6 grams of protein per kilogram of body weight daily. For a 150-pound person, that's roughly 80 to 110 grams of protein per day. This is significantly higher than what most seniors currently consume. Here's the critical mistake I see repeatedly. Seniors often eat most of their protein at dinner, consuming maybe 40 to 50 grams in one meal while having minimal protein at breakfast and lunch. Your body can only process about 25 to 30 grams of protein effectively for muscle building at one time. Anything beyond that gets used for energy or stored as fat, not converted to muscle. This means that big steak dinner isn't doing you as much good as spreading that protein throughout your day. Quality matters as much as quantity when it comes to protein. Your body needs all 9 essential amino acids to build and maintain muscle tissue. Complete proteins like eggs, fish, poultry, dairy products, and certain plant combinations provide these essential building blocks. I often recommend spreading protein intake throughout the day, aiming for 25 to 30 grams at each meal. This approach optimizes muscle protein synthesis, the process by which your body builds new muscle tissue. Let me give you some practical examples of what 25 to 30 grams of protein looks like in real meals. For breakfast, that could be 3 eggs with a slice of cheese or a cup of Greek yogurt with nuts. For lunch, a palm-sized piece of chicken breast or fish, or a large serving of beans with quinoa. Many of my patients are shocked to learn that their typical breakfast of toast and coffee contains almost no protein, setting them up for muscle loss from the very start of their day. But protein alone isn't enough. This is where resistance training becomes crucial. When I say resistance training, I'm not talking about becoming a bodybuilder. I'm talking about activities that challenge your muscles against resistance, whether that's your own body weight, resistance bands, light weights, or even household items. The goal is to progressively challenge your muscles so they adapt by becoming stronger and more resilient. The science behind this is fascinating. When you challenge a muscle, you create microscopic tears in the muscle fibers. This might sound scary, but it's actually exactly what we want. During recovery, your body repairs these tears with new protein, making the muscle slightly larger and stronger than before. This process, called muscle protein synthesis, can continue for up to 48 hours after exercise. This is why rest days are just as important as workout days. That's when the actual muscle building happens. Let me give you a practical example that many of my patients find helpful. Start with a simple chair exercise. Sit in a sturdy chair and stand up without using your hands. If this is challenging, that's perfectly fine. It means we have room for improvement. Practice this movement 10 times, 3 times a week. As it becomes easier, you can add variations like holding the standing position for a few seconds or standing up more slowly to increase the challenge. Here's where I want you to pause and engage with our community. In the comments below, share one physical activity you used to enjoy but haven't done in a while. It could be dancing, gardening, hiking, playing with grandchildren, or anything that brought you joy. Our community is incredibly supportive, and you might find others who share similar interests and can offer encouragement or even become activity partners. Now let's address the elephant in the room: safety concerns. Many people over 65 avoid resistance training because they're worried about injury. This is understandable, but often based on outdated information. When done correctly, resistance training is not only safe for older adults, but actually reduces injury risk by strengthening muscles, bones, and connective tissues. The key is starting slowly, focusing on proper form, and gradually progressing. Balance is another critical component that often gets overlooked. Every year, 1 in 4 adults over 65 experiences a fall, and falls are the leading cause of injury-related death in this age group. But falls aren't an inevitable part of aging. They're often the result of decreased muscle strength, poor balance, and reduced coordination, all of which can be improved with targeted exercises. What many people don't realize is that balance isn't just about your inner ear or vision, though those are important. Your muscles, particularly in your legs and core, are constantly making tiny adjustments to keep you upright. When these muscles become weak, your body loses its ability to react quickly to prevent a fall. This is why someone might feel unsteady on their feet, even when standing still. Their stabilizing muscles simply aren't strong enough to do their job effectively. The good news is that balance can be improved at any age. Research shows that even adults in their 80s and 90s can see significant improvements in balance and stability with just a few weeks of targeted training. The key is progressive challenge, just like with strength training. Simple balance exercises can be incorporated into your daily routine. Try standing on one foot while brushing your teeth, walking heel to toe in a straight line, or practicing standing from a seated position without using your hands. These exercises improve proprioception, your body's awareness of its position in space, which is crucial for preventing falls and maintaining confidence in your movement. Let's also talk about bone health, which is intimately connected to muscle health. Osteoporosis affects over 54 million Americans, with postmenopausal women and older adults being at highest risk. The good news is that weight-bearing and resistance exercises not only build muscle, but also stimulate bone formation. When you challenge your muscles, you're also challenging your bones, encouraging them to become denser and stronger. Here's something most people don't understand about bone health. Your bones are living tissue, constantly being broken down and rebuilt throughout your life. This process, called bone remodeling, can work for you or against you, depending on the signals you send your body. When you put stress on your bones through resistance exercise, you signal your body that these bones need to be strong. Your body responds by increasing bone density. When you live a sedentary lifestyle, you signal that these bones don't need to be strong, and your body responds by allowing them to become weaker. The process isn't immediate. Bone remodeling takes months to years, but the changes are real and measurable. Studies show that postmenopausal women who engage in regular resistance training can not only stop bone loss, but actually increase bone density by 1 to 3% per year. That might not sound like much, but over time, it can mean the difference between fracturing a hip in a fall and walking away uninjured. Nutrition plays a supporting role in bone health too. While calcium often gets all the attention, bone health requires a symphony of nutrients working together. Vitamin D is crucial for calcium absorption and muscle function. Magnesium supports bone structure, and vitamin K2 helps direct calcium to your bones rather than your arteries. A diverse diet rich in leafy greens, fatty fish, nuts, seeds, and quality dairy products provides many of these essential nutrients. I want to address a common misconception about cardio versus strength training for older adults. While cardiovascular exercise is important for heart health and endurance, it doesn't provide the muscle and bone building benefits that resistance training does. The most effective approach combines both types of exercise. You might walk or swim for cardiovascular health, while also incorporating resistance exercises for muscle and bone strength. Flexibility and mobility work shouldn't be forgotten either. As we age, our connective tissues become less elastic, leading to stiffness and reduced range of motion. Regular stretching, yoga, or Tai Chi can help maintain and improve flexibility while also providing gentle resistance that supports muscle and bone health. These activities also offer stress reduction benefits, which is important since chronic stress can negatively impact bone density and muscle recovery. Sleep deserves special mention in our discussion of healthy aging. Quality sleep is when your body does much of its repair work, including muscle protein synthesis and bone remodeling. Adults over 65 often experience changes in sleep patterns, but consistently getting 7 to 8 hours of quality sleep remains important for maintaining muscle mass and bone density. If you're experiencing sleep difficulties, this is definitely worth discussing with your healthcare provider. There's a fascinating connection between exercise and sleep quality that creates a positive cycle. Regular physical activity, especially resistance training, can improve sleep quality and duration. Better sleep, in turn, enhances recovery and muscle building. Growth hormone, which is crucial for muscle maintenance and bone health, is primarily released during deep sleep. When sleep quality is poor, growth hormone production decreases, making it harder to maintain muscle mass and bone density regardless of your diet and exercise efforts. Many of my patients report that their sleep improved dramatically once they started a regular exercise routine. They fall asleep faster, sleep more deeply, and wake up feeling more refreshed. This isn't just anecdotal. Numerous studies confirm that regular physical activity is one of the most effective non-pharmaceutical interventions for improving sleep quality in older adults. Let me share a success story that illustrates what's possible. I have a patient, Margaret, who came to see me at age 72, feeling weak and unsteady. She'd fallen twice in the previous year and was afraid to leave her house. We started with simple exercises she could do at home: chair stands, wall push-ups, and basic balance work. We also adjusted her protein intake and ensured she was getting adequate vitamin D. 6 months later, Margaret had not only regained her confidence, but was stronger than she'd been in years. She was back to gardening, which she loved, and even started taking dance classes with her husband. Her bone density scan showed improvement, and her muscle mass had increased significantly. Margaret's transformation wasn't the result of extreme measures. It came from consistent, appropriate action based on sound principles. Now, I want to be clear that everyone's situation is different. What worked for Margaret might need to be modified for your specific circumstances, health conditions, or physical limitations. This is why I always recommend consulting with your healthcare provider before starting any new exercise program, especially if you have existing health conditions or concerns. However, don't let perfect be the enemy of good. Even if you can't do everything I've discussed today, doing something is infinitely better than doing nothing. Start where you are with what you can do and build from there. The most important step is the first one, and the second most important is the one that comes tomorrow, and the next day, and the one after that. Consistency trumps intensity every single time, especially for older adults. I'd rather see someone do 10 minutes of gentle resistance exercises every day than an hour-long intense workout once a week. Your body adapts to regular, consistent stimulation. Sporadic, intense efforts often lead to injury and discouragement, causing people to give up entirely. This is where the concept of progressive overload becomes important. You don't need to start with heavy weights or complex exercises. Start with what you can do safely and comfortably, then gradually increase either the difficulty, the number of repetitions, or the frequency. Maybe this week you can do 5 chair stands. Next week, aim for 6 or 7. The week after that, try holding the standing position for a few seconds longer. Small, consistent improvements add up to remarkable transformations over time. I also want to acknowledge that staying motivated can be challenging, especially when progress seems slow. This is normal and expected. Building muscle and bone density is a gradual process that requires patience and persistence. Celebrate small victories, being able to stand up from a chair more easily, walking upstairs without getting winded, or feeling more stable on your feet. These improvements, while they might seem minor, represent significant gains in your functional capacity and quality of life. Community support can make a huge difference in maintaining motivation and consistency. Consider joining a local senior center, finding an exercise buddy, or participating in group classes designed for older adults. Many communities offer programs specifically tailored to seniors, often with instructors trained in age-appropriate exercise modifications and safety considerations. Technology can also be a helpful tool. There are numerous apps and online programs designed specifically for older adults, offering guided exercises, progress tracking, and even virtual community support. Don't be intimidated if you're not tech-savvy. Many of these resources are designed to be user-friendly and accessible. However, I want to emphasize that you don't need fancy equipment or expensive memberships to get started. Some of the most effective exercises for seniors can be done with items you already have at home. Canned goods can serve as light weights. A sturdy chair provides support for balance exercises and can be used for seated strength training. A towel can become resistance equipment for upper body exercises. The key is creativity and consistency, not expensive equipment. I also want to address the role of healthcare providers in your fitness journey. While I encourage everyone to be proactive about their health, it's crucial to work with your doctor, especially if you have chronic conditions like heart disease, diabetes, arthritis, or osteoporosis. These conditions don't prevent you from exercising, but they may require modifications to ensure your safety. Your healthcare provider can help you understand what activities are appropriate for your specific situation and may even refer you to a physical therapist or exercise physiologist who specializes in working with older adults. As we wrap up today's discussion, I want to leave you with some practical next steps you can take immediately. First, assess your current protein intake for a few days. Are you getting enough at each meal? Second, try the chair stand test I mentioned earlier. How many can you do safely? This gives you a baseline to improve from. Third, consider what barriers might be preventing you from being more active and brainstorm simple solutions. Let me give you a simple weekly plan to get started. Monday, Wednesday, and Friday, focus on strength exercises, even if it's just chair stands, wall push-ups, and some light arm movements with canned goods. Tuesday and Thursday, work on balance. Practice standing on one foot, walking heel to toe, or doing gentle yoga poses. Saturday, take a longer walk or do an activity you enjoy that gets your body moving. Sunday, rest and focus on meal preparation to ensure you're getting adequate protein throughout the week. Track your progress in a simple notebook or calendar. Note how many repetitions you could do, how you felt during and after exercise, and any improvements you notice in daily activities. This record-keeping serves multiple purposes. It helps you see your progress over time, identifies patterns in what works best for you, and provides motivation when you can look back and see how far you've come. Remember, the goal isn't to turn back the clock or compete with your younger self. The goal is to be the strongest, most capable version of yourself at your current age. Every bit of muscle you build, every improvement in balance you achieve, and every step you take toward better health is an investment in your future independence and quality of life. If you found today's information helpful, I encourage you to subscribe to our channel and hit that notification bell so you never miss our latest health insights. Please share this video with friends or family members who might benefit from this information. Together, we can help more people age with strength, confidence, and vitality. Your health journey is unique, and it's never too late to start taking positive steps. Whether you're 65 or 95, your body is capable of positive changes when given the right stimulus and support. Thank you for joining me today, and I look forward to continuing this conversation in future videos. Until next time, stay strong, stay curious, and remember, your best years can still be ahead of you.